I'm Dr. Christine Gyldenkerne from the Department of Cardiology at Aarhus University Hospital, Aarhus, Denmark. I would like to present the results of our study called Nationwide Trends for Myocardial Infarction and Mortality among type 2 diabetes patients. Risk management of patients with type 2 diabetes has changed significantly within the last decades, with increasing focus on multifactorial prevention of cardiovascular disease. Accordingly, a few cohort studies have demonstrated declining cardiovascular morbidity and mortality rates in patients with diabetes. These studies included patients with prevalent diabetes as well as cardiovascular disease, where prophylactic cardiovascular treatment is always indicated. However, it is less examined how changes in risk management have been implemented and affected the prognosis in patients with newly diagnosed type 2 diabetes and no previous cardiovascular disease. We conducted a nationwide retrospective cohort study of all patients with newly diagnosed type 2 diabetes in Denmark. We use national health registries to identify all patients with newly diagnosed type 2 diabetes between 1996 and 2011. Patients were included on the date of the first ever redemption of a prescription for a glucose-lowering drug. On the inclusion date, each patient with diabetes was matched on sex and age in a 1:5 ratio with 5 persons from the general population without diabetes. All were followed for 7 years, with the last patient concluding follow-up in 2018. Patients less than 30 years of age were excluded to limit including those with type 1 diabetes. We also excluded all with previous cardiovascular disease. We found that patients with newly diagnosed type 2 diabetes experienced major reductions in risk of myocardial infarction and mortality. From the first inclusion period to the last inclusion period, the 7-year risk of myocardial infarction decreased from 6.9% to 2.8%, leading to an absolute risk reduction of 4.1%. Based on the 7-year hazard ratios, the relative risk reduction of myocardial infarction was 61% in patients with diabetes. For mortality, the 7-year risk decreased from 28.8% to 16.6%, with an absolute risk reduction of 12.2%. The relative risk reduction of mortality was 41% in patients with diabetes. The risk difference between the diabetes cohort and the matched general population cohort narrowed over time for both myocardial infarction and mortality. In fact, the risk of myocardial infarction over a 7-year period was only 0.6% higher among patients with diabetes than found in the general population in the last study period. During the study period, we observed an increased use of prophylactic cardiovascular medications within 1 year of diabetes diagnosis. Hence, from the first inclusion period to the last inclusion period, the proportion of patients using statins increased from 5% to 59%. We further observed that use of antihypertensive drugs increased up to 4-fold during the study period, and we also observed an increased use of aspirin. From 1996 to 2011, patients with newly diagnosed type 2 diabetes and no previous cardiovascular disease had major reductions in the 7-year risk of myocardial infarction and mortality. These changes coincided with increased use of prophylactic cardiovascular medications. Compared with a matched general population cohort, the initial large risk difference between patients with diabetes and the general population decreased during the 15-year study period for both outcomes. Our data suggests that there is room for further improvements. These includes increased use of statins, as only around 60% of patients with diabetes used statins in the last study period. Other aspects that might be relevant in reducing cardiovascular risk in patients with newly diagnosed type 2 diabetes and no previous cardiovascular disease may involve increased use of antihypertensive drugs, add-on of new medications such as SGLT2 inhibitors and GLP-1 analogs, as well as lifestyle changes. Our study documents major prognostic improvements in patients with newly diagnosed type 2 diabetes and no previous cardiovascular disease. Yet, our study indicates that there is room for further improvements in prophylactic treatment of these patients. COVID-19 has not impacted the study.